I'm an extension associate with the Department of Ag and Bioengineering at the University of Illinois, and I work with Dr. Rudolphi to do research and outreach to serve our agricultural population. We provide resources and services related to mental health. Our biggest one is our Illinois Agricultural Mental Health Voucher Program. And so that connects farmers, workers, and their families with free mental health care. And so that program is really to reduce barriers to care. We know that farmers and agricultural populations experience worse mental health than the worst population. They have higher suicide rates, and they face more barriers to receiving care. So we created this program to combat that. So what this program does is they can receive 3 vouchers, and it helps them dip their toes in the water of therapy, and then they can see what professional mental health care is like.
So it's really easy, and right off the bat, there's no cost to it.
No, they don't have to pay anything up front. So they request the vouchers, and if they are an agricultural producer, worker, or family member, and they reside in Illinois, they are eligible. And then they will receive a directory of our participating providers in the program. And then they can choose to redeem the vouchers with any participating provider. And then we reimburse the providers directly. They don't have to provide proof of insurance at all. And again, we reimburse the providers.
This program seems quite unique.
Mm-hmm.
And it's been going on for, what, 2 or 3 years now?
Yeah, about 2.5, 3 years.
Okay. What's the success on it here? Have you had a lot of farmers take you up on the deal?
Yeah, so I think at first it was kind of hard to get the buy-in because there's a lot of stigma surrounding mental health and help seeking, especially among farmers and rural populations, because there's this idea that you need to fix things on your own. They see themselves like their tractor. It only needs fixed if it's broken. But that's not necessarily true. But what we have seen is since 2022, we've had a 521% increase in our services requested.
520% increase in services requested.
Yes.
So that's just the number of increase of farmers who have come back and wanted more, and more farmers have wanted it, and the word has gotten around in the coffee shops that, hey, this is a pretty good deal.
Mm-hmm. Yes, and we've also done marketing efforts through the Illinois Department of Agriculture, and we also make print resources like this. So we create these visually appealing print resources that also have the voucher program information, as well as different hotlines and other resource information to also get the word out when we're at different farm shows, to make the information just more accessible.
Okay. If someone is thinking about this as an opportunity, but they don't really know, do I really have anything to talk about? How do they determine if they are a real candidate for this program?
Well, I mean, I think anybody and everybody should be talking to someone about their life, because you don't need to go to a mental health professional only when you're in crisis. You want to go there before things get to that point.
Why is that?
Well, we want to prevent it before it gets to a crisis situation. We want to prevent these suicide situations.
Okay, and you've been successful in doing that, we hope.
We hope. I mean, we can't. We haven't collected. It's hard to collect data on that. But I mean, with our increase in the uptake of services, I would hope that we have been successful. And I think with the nature of the world and the agricultural economy right now, I think it's especially important, even if you don't feel like you need the help immediately, that you establish that connection with a provider now, because things might start to get rocky here in a few months.
Now, establishing that relationship with the provider, how many providers around the state are you working with? Are we talking about 10 or 50 or?
So we actually have more than 80 partnering providers across the state, and most of them offer telehealth services, and that is to help combat those accessibility and availability barriers that often come with rural mental health care.
So you could talk to somebody on the telephone. You don't have to go to their office and lay down on the proverbial couch then.
Yeah, and actually a lot of times, mental health care isn't a lot of times you go lay on the couch. It's a lot more casual than what you may imagine it to be.
Okay, give me an idea of what you mean by more casual.
Well, I mean, I personally go to therapy, and a lot of people I know go to therapy. When I go, I don't even go to a check-in receptionist. I just go when my appointment time is, and my therapist will then come out to the waiting room and take me to the office. So you're not even interacting with that extra receptionist that, especially in a rural area, you may know. So that could cause someone to not go seek care. And then when you're in the office, you're sitting on a comfortable couch, and the room is just more inviting rather than sitting on the proverbial couch as you may imagine it. It's just more of a conversational setting.
And as we look around the state, are they scattered, the providers, are they scattered around the state, or would somebody have to travel, or is it along, how are they distributed? Have we gone to folks and said, hey, would you help us? And you've got them pretty well scattered around the state conveniently?
Yeah, I think we have a pretty good spread around the state, and again, if there isn't a provider within driving distance, we do have most of them offer those telehealth services.
Okay. And how do we get a hold of the vouchers and more information about the program? Do you have a phone number or a website for getting information about this program?
Yeah, so you can email us at farm-stress@illinois.edu.
Ooh, do that one again. farm-stress@illinois.edu. All right. farm-stress@illinois.edu.